Hello there, this is Dr. Sangeeta Chaudhary. Speaking about Sjogren syndrome, Sjogren is an autoimmune disease. It mainly involves exocrine glands like lacrimal glands and salivary glands, though it can involve other organ systems as well. It can involve joints leading to arthritis, it can involve lung, it can involve kidneys, it can involve skin. So any other organ system per se can be involved in Sjogren syndrome. What are the symptoms of Sjogren syndrome? Okay, if the patient has involvement of lacrimal gland, they will present with dry eyes, redness, itching of the eyes, burning sensation, foreign body sensation in the eyes. If they have involvement of salivary glands, they may present with dry oral mucosa. They will complain of dryness of the mouth. They'll have difficulty in chewing, they'll have difficulty in swallowing, they'll have difficulty in speaking continuously. Okay, so these are the common symptoms of a patient with Sjogren syndrome. They will also have enlargement of the parotid glands. Bilateral parotid glands will be enlarged. And if they have systemic manifestations, they may present with symptoms of other organ systems involvement. Very commonly, they can present with arthritis because of involvement of joints, right? So there can be other manifestations, as I said. And how do we diagnose Sjogren's? Of course, we will take the clinical features into consideration and we will look for we'll take biopsy from the minor salivary glands to look for the lymphocytic infiltration in the glands. And regarding the autoantibodies, we will do autoantibodies like anti-Rho SSA or anti-La SSB. So these will be positive in Sjogren syndrome, right? But then Sjogren's syndrome, they also present with dry eyes and dry mouth. This can be seen in other diseases as well, like for example, simply in case of allergies, also the patient may complain of dryness or itching of the eye, dryness of the mouth. And then other systemic diseases can also present with dryness of eyes and dryness of mouth. So you'll have to differentiate between other diseases with Sjogren's. And how do we treat? For symptomatic relief, we will give lubricants for the eyes, as well as we will ask the patient to take water to reduce the dryness in the mouth. And we will give gums, flavored gums, and sugar-free lozenges for the patient to locally stimulate the salivary glands to release the saliva. And we will also give systemic drugs like pilocarpine and cevimeline for dryness of eye, even for dryness of mouth, okay, for the systemic stimulation. So these are the supportive management. And if there are systemic manifestation, we will give different immunomodulators like immunosuppressive agents like steroids or azathioprine. All those immunomodulators we can use. So in short, this is how we can manage a case of Sjogren syndrome. Thank you.